How to use picture communication boards. The Emergency Communication for All Picture Communication Board is brought to you by TechOWL at the Institute on Disabilities at Temple University in the College of Education and Human Development. This is a free printable tool designed to help facilitate communication with non-speaking individuals. It is available to download in 2 different sizes, with English and Spanish vocabulary options. The communication aid has pictures of important words such as yes, no, stop, question starters, and medical vocabulary that would allow a person to express their needs. There is also a small letter keyboard to allow for the flexibility of spelling out responses. Finally, on the far right side, a diagram of a body allows the user to identify areas of concern or pain that they may be experiencing. Catherine and Haley, speech-language pathologists and AAC experts at the Institute on Disabilities TechOWL team, are here to answer your questions about picture-based communication. Who could benefit from this tool?
Okay, so this type of tool can really help all individuals with communication needs. So this could be some people who are non-speaking or semi-speaking. This can also be those who are unintelligible, so their speech might be hard to understand or it might be unclear sounding. Also people who are ill or having difficulty speaking due to short or long-term medical needs such as shock, trauma, or even losing your voice when you're sick or after a medical procedure or surgery. People who speak a language other than English, or if English is not their first language, they can also use these boards to communicate with somebody who speaks English or maybe 2 completely different languages as well. So many of these symbols can be understood and can be used to help people who don't speak that same language be able to communicate together.
In fact, the boards as they are created right now have the English on the front side, and because we do have a very large Spanish-speaking population in the city of Philadelphia, we have Spanish on the opposite sides.
Where might this tool be used?
Well, communication in an emergency context is going to take place in the moment. So this could be used either by the emergency responder who sees somebody in distress and is trying to help them sort of get at what they need to say, or it could be included in an emergency kit like a go bag for a family where the family has somebody who's non-speaking or can't speak intelligibly as a member of the family. And they could even practice using it ahead of time and make sure that they have it. And, stuff is going to be happening in context. So it'll be happening outside of somebody's home if there's an emergency or in the ambulance. And they'll be able to point to the symbols and talk about what the symbols mean and also point to the things around them in the environment that they might be referencing.
How would you introduce a picture communication aid?
You could also model how to use it by pointing to the pictures on the board and then things in the environment. So like if you're going to be pointing to something like, are you thirsty? Do you need to drink? You could point to the drink picture and then point to the water bottle and just use that kind of modeling to show them how it works.
Is there a way to use a tool like this with someone whose disability limits their movement so that maybe they can't point accurately?
So you can modify using this. So if you're not able to directly point to the pictures, maybe your communication partner might read off the different rows. Might say, like, is your word that you're looking for in row 1? And the person, if they can indicate a yes or a no, they can then help them. Let's say their word is not in the first row. Is it in row 2, row 3? And then you can go into the columns to help try to find that word. And sometimes a yes might not be a verbal or a spoken yes. It might be maybe a blink. It might be a nod. But you want to establish that with the person that you're speaking to before you go through kind of navigating the rows or the columns. And it doesn't have to be pointing to rows and columns. It could be, is it on this side or this side? Is it on the top? Is it on the bottom? To help narrow that down.
And if you're including this in an emergency kit for somebody, let's say it's an individual who uses a high-tech communication device, and let's say they do scanning on their device by quadrant, then maybe you practice with that person ahead of time and physically draw quadrants respond to this so that you can just go by the same navigation path that you would have taken on the high-tech device.
Are there any other techniques that you would recommend to supplement the use of the picture communication board?
I think, again, pointing to things in the environment, referencing things around the person, but there are a few other things that you could be doing, which is, if you're preparing this as part of an emergency kit, or even for somebody at, let's say, a vaccination center, there's space along the bottom. You could potentially Velcro some other pictures onto the board if you wanted to have that available for information that was really specific to that particular context. But also, if you're talking with somebody, let's say who's had a reaction to a shot, or whatever the situation is, likelihood is that somebody in that group or that family has a smartphone. So you could also get out their smartphone and start scrolling through the pictures and referencing things that that person is going to be familiar with from their family or their home. So they might be able to ID dad or ID mom or ID their wife, and be able to use the pictures to supplement.
And any quick changes too to the board in the moment, if this is, say, too many or it's too overwhelming for one person to look at, because there's a lot of buttons on here or icons on here, and some of them are small, there's a lot happening. You can use maybe a plain piece of paper to cover it up. You can fold the board over if you need to narrow down those choices to give somebody maybe a quicker response so that they don't have to sort through or look through all of this vocabulary if you need, that yes or no answer, or you need that direct response in a moment really fast.
What other advice would you give to first responders or healthcare providers interacting with non-speaking patients?
I think the first thing I would say is to speak directly to that non-speaking patient. Don't assume that they can't understand. Don't assume that they aren't deeply involved in what you're talking about. Obviously, if it's an emergency situation, you want to be talking directly to that person about what you're doing, what the situation is, and just generally also when you're speaking with somebody with a disability, we hear situations where somebody assumes that the person can't understand, so they start speaking extra slowly or start shouting. And maybe you want to slow your rate a little bit, but you really just want to address that person as a human being who's going to be part of the decision-making process in that context.
You can modify your speaking as you go along in the conversation, just like you would with anyone that you're communicating with, whether they use something like this to communicate, or they use their voice or signs.
Thank you for joining us to learn about the Emergency Communication for All Picture Communication tool. To learn more or to download this tool, go to techowlpa.org/eprep.